So I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there were so many perverse incentives, and these are model studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved lives?
That's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
Fired Dr.
Go to the Trump Surgeon General.
They fired Dr. Krauss. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krauss.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant?
Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no. I'm giving a quote. And I asked her twice.
No, 1 second. And you're also repeating now that she is a liar, correct? What you wrote in the Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ACIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Health Committee, maybe this committee as well. All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called big, beautiful bill threw 15 million Americans off of health care, substantially raised premiums, and is going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, is that really making America healthy again?
It's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern-day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. I said that in terms of affairs reports a while ago. I said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine was perfectly matched to the virus that was circulating then. And I have no idea how many lives it saved, but it saved quite a few.
I don't understand why, just the rabbit hole some of my colleagues are going down. There's a big difference. When I was out there practicing, doing volunteer work, I was so confused myself on the numbers. People dying with COVID versus from COVID. And we still don't have that message, and I think that's what I hear you saying as well. How many people died from COVID versus with COVID is a different answer. The situation today is so different when this monster virus was made in a laboratory in Wuhan, China, and none of us had ever seen this virus, and we had no immunity to it. But today, every American's had COVID a dozen times probably, and we built up immunity. I think that's why that both things are true. It was a miracle. Warp speed was a miracle. What President Trump and his team did, and it saved millions of lives most likely. But it's also true that it probably killed some people. Like most vaccines do, there is a death rate associated. So both things are true. Anything else you want to clear up on the morbidity, mortality of COVID and COVID vaccines?
Well, I think you just cleared it up. The COVID vaccine was critical. President Trump's leadership got it to us when our society was locked down. It allowed us to open up. It was, as I said, perfectly matched to a virus that was new in the experience of humanity. And so it was a miracle. Right now, we're dealing with completely different circumstances, where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different, and it's complicated. And, if you just want to turn everything into a soundbite, it makes it, you can't have a grown-up conversation. But, there were more reports to VAERS, which is the only surveillance system that we have, of injuries and deaths from that vaccine that all vaccines put together in history. So we have to acknowledge that there was a cause. We acknowledge that there was a benefit. We can't quantify either one because of the data chaos at CDC, and that's all I'm saying. And they think I'm being evasive because I won't make a kind of a statement that's almost religious in nature. Did it save 1 million lives? Well, there's no data to support that. Or maybe data, there's no study, that there's modeling studies, there's faulty data. I'm not going to sign on to something if I can't do it to a scientific certainty. It doesn't mean that I'm, anti-vax. It just means I'm pro-science.
You said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses.
Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
You said that you're soon going to release a study claiming to reveal the cause of autism. timed, unsurprisingly, with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children, so I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a
Do
contractor.
you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what
I'm going
the,
to pull up the website for you.
he's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee
Well, I don't
that you
know
were
if a
wrong?
contractor can be classified as a senior data
All right,
analysis
sir.
or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board, he sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're
It's incredible,
ridiculous.
sir. So here's the question I have. You brought him in to do this study. I think there's no question
I
about that.
told you he's not doing a study.
Is he participating in the study?
No, what
Is he
he's
doing
doing,
any analysis in regards to this study?
no, what he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months,
Secretary, let me ask you this question, just so because you know the answer. What is Mr. Geyer doing?
he is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So
is he
because
Mr. Secretary,
CDC
I
will not
appreciate
give
that.
us, they have
Mr.
disadvantaged.
Secretary, is he participating in this then?
No, he
But
is.
you just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you
No, because
just
you're
want to
confusing me.
show?
Mr.
Do you
I'll-
just
I'll
want to
submit it.
showboat?
I'll submit
You
this.
just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues. And with others
I'm
you
willing to
pretend not
give you the
know.
answer. I'm
Maybe
willing to
someone-
give you the
Mr.
answer.
Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move
I don't
on.
even know what you're talking about.
Mr.
You're
Secretary-
talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to
Does
answer.
this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Geyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because
you commit to give
that's
it?
not the way it works.
Will you
You don't
commit-
even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for the study by the end of the month?
We already have
You
put
just said it's
out,
public.
we put out the notice of funding opportunities, and then the scientists from all over the world.
You're not understanding me. Let me speak
No,
clearly
you're not
again.
understanding how the world works.
Do you understand what the protocols
Senator-
are? Do you understand what they are?
The scientists who are doing the studies submit the protocol.
Okay, so you know
That's
what
not
they
coming
are.
from
Okay,
us.
So will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the Secretary. I'll ask for support from the leadership of this committee to ask for those protocols. If those protocols are not given to this
Anybody
committee,
can get the protocols.
Mr. Secretary, I'm not talking to you. Mr. Chairman, what I'm
If
asking,
the protocols are public, we can work with you to.
what I'm
get
asking,
access to-
Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with the subpoena to get them.
No, I will not agree to subpoena anything.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.